Hello everyone, this is Dr. GERARD CUOMO here in my private office in Boca Raton, Florida. Today we're doing Julia's case, and she presented with a lower, as we discussed previously in our last video. Her angulation of her implant bodies were, well, they weren't parallel, but they were not exactly this. We did not have to use any multi-level abutments for her case. So for those of you in the audience that are patients, this is a very nice service because she actually had her teeth removed in one appointment and a fixed prosthesis placed as what we call an immediate load fixed denture. So here is Julia's fixed restoration that's going to go in today, and it is a processed fixed denture that has 4 implant abutments. And so we're going to use these 4 screws to place down inside each one of these access holes. And then once we do that, we'll tighten them down, and then this will stay permanently in her mouth. And the nicest thing about this is if we have to refurbish this in any way, shape, or form, we can do that within a day. And Julia would not have to go without teeth because she is wearing her temporary. Now, she's been wearing her temporary prosthesis for a while, so it did show some wear and tear, but we're going to hang on to it. And right now, the access holes are all covered with this orange material, which is super, super soft. It's just a rubber material, a gasket, if you will. So we show you how we pull that out. And we'll go ahead and pull that out. And we have one back here. That might have come out already, or part of it might have come out. Let's try this one. There we go. And these work pretty well, but as long as there's no undercuts. Alright. And we got one more. So we've already seen Julia. This is like her 4th appointment, where we did have to do one remounting of her case, but it's a lot better now, and things are looking good. Alright, we'll just reach in and get a mirror. That feels like there's still a little bit more inside there. Yep. There it is. I'll just spin that out of there. At times I have to use a different instrument. Alright, there it comes. There it is. So those are the 4 plugs. And then again, we just go in and just dry those areas. Great. That kept the food and debris out of the way. And now what we're going to do is we're going to unscrew these 4 screws, take this out, and then place her new one right in place. Alright, so that's the next step. I'm going to try to cover this all in this video, so hopefully we won't run out of time. Here we go. Open nice and wide, Julia. Alright. I'm just going to unscrew. There's one. Now the emergence profiles to each one of these implants is a little wider on the final than it is on the temporary. And the reason is because when we took our impression, we had my modified impression copings in place. And that was able to transfer right to the final model work, which I covered in another video of Julia's case. Let's see, there seems to be something inside this last one. Let's find out what that is. Alrighty. Oh, it's just the shaft or the access hole. There we go. One more to undo. See if we're going in the right direction. There we go. Remember, you're lefty-loosey, not righty-tighty. So this is going to come out. Of course, it's coming out in a couple of pieces. The surgeon had to section it and apply it and put it together. So first things first, we're going to use a special suction. That's our micro suction. We'll just make sure the debris is and we have some threads that are clear from any debris. So we just suction each. 1, 2, and 3, and 4. That's it. We'll take a quick look down on each. Looks good. Looks good. Looks good. We're ready to go. Alright, now what we're going to do is put our screws within the prosthesis so they drop in like so. There's one. Cotton plier. There's 2. And I check all these screws before the patient shows up to make sure there's absolutely no debris from the lab. You know, sometimes our labs, even though they steam all these parts and sterilize them, sometimes there might be a little bit of debris, so we double check all that. And our mini lab. Alright, here comes the prosthesis, so we're going to just slowly put that right in place. And Julia, you'll feel just a little pressure at first. We want to just line this up. Alright, one at a time, we'll tighten her down. There it goes. Try it now. Once you get one screw caught and going, the rest go fairly easy. Maybe her lip was holding it in. Try this back one. Yeah, and back one. So we're going to go ahead and just get this all tightened, and when we're tightened down, I'll come back at you. All right. Dr. Gerard Cuomo here in Boca Raton with an augment in a little bit.